Have you ever received a medical report, perhaps after a biopsy, and found yourself staring at unfamiliar terms that seem to hold important answers, yet leave you feeling more confused than informed? It is completely natural to want to understand every part of your health information, especially when it involves something as significant as a biopsy. When you see the term gross description on a biopsy report, it refers to the pathologist's initial observations of the tissue sample using only the naked. This is the first step in analyzing the tissue, where its size, shape, color, consistency, and any visible abnormalities are carefully documented before it is examined under a microscope. This initial, naked eye assessment is crucial because it provides vital context for the more detailed microscopic examination that follows. Think of it as mapping the landscape before exploring the tiny details. For kidney biopsies, for instance, the gross description might note the overall size of the kidney tissue, if there are any visible lesions, how many tissue cores were collected, their length, and whether any obvious cysts or masses are present. These macroscopic findings help the pathologist orient the tissue, select the most important areas for microscopic slides, and can even hint at the nature of the disease, guiding their focus towards specific characteristics or areas of concern. While the gross description might seem technical, understanding its purpose can help you have a more informed conversation with your doctor. You can ask your healthcare provider to explain what was observed macroscopically in your specific biopsy. For example, knowing if a suspicious area was noted for its unusual color or texture can help you visualize what the doctors were looking at. This section also confirms that the tissue received matches what was expected from the procedure, ensuring the right sample is being analyzed. It is a foundational piece of information that sets the stage for the final diagnosis. Did you know that the term gross in gross description originates from the Latin word grossus, meaning large or coarse? It is not referring to anything unpleasant, but simply to observations made without magnification. This initial visual inspection is so fundamental that expert pathologists can often form a preliminary hypothesis about the tissue's condition based purely on its gross appearance, even before the microscopic analysis begins. This process ensures a thorough and methodical examination of every sample. Ultimately, the gross description is an essential first chapter in the story of your biopsy report. It is the big picture, visible to the unaided, that helps frame all the microscopic details that come next. Understanding this basic step empowers you to better grasp the full scope of your diagnostic information, allowing for more productive discussions with your healthcare team about your kidney health.